Physiatrists are physicians who specialize in physical medicine and rehabilitation, or pm&r. We are board-certified physicians with expertise in diagnosing and treating acute and chronic conditions, including muscle and joint problems, back and neck pain, and neurological conditions that affect how you move and function. Physiatry focuses on non-surgical care that combines orthopedics, neurology, sports medicine, rheumatology, internal medicine, and radiology. We specialize in detailed physical exam techniques, nerve and muscle testing, biomechanics, gait analysis, bracing and prosthetics, and pain management, including ultrasound and X-ray guided injections. Physiatry gained recognition in the 1940s when veterans injured in war and children disabled by polio or cerebral palsy were medically stable but physically not ready to return home. Using innovative techniques, these doctors guided patients to heal and to achieve their maximal function. Today, the benefits of physiatry, with a focus on non-surgical care, fuel a growing demand from the very frail to the very athletic. We work closely with other healthcare providers to treat the whole person, not just the problem area. As physicians, we aim to accurately pinpoint the source of your problem, to create individualized treatment plans, and guide you on how to avoid injury in the future. Physiatrists strive to improve your function and maximize performance so you can feel better, move better, and do the things you want to do. Call us if you have questions. The team at Spine West looks forward to helping you.